If you want to know if the pandemic is over, why not just look at the number of deaths due to COVID? You hear these numbers on the news every day anyway. Unfortunately, life is not that simple. Deaths due to COVID come from the cause of death listed on individual death certificates. Have you ever filled out a death certificate? I have. And let me tell you, it's not nearly as straightforward as you may think. Let's start with an example. When I was an intern, I had a patient who was in a coma after a car accident. He was in the hospital. He didn't wake up after 3 days, which means it's very likely that he never will wake up. As often occurs in this situation, he developed pneumonia on a ventilator. I was in a meeting with the family, actually to decide whether to pull the plug, when he had a massive heart attack and absolutely dropped dead. So, what's the cause of death? Is it the heart attack, pneumonia, brain injury, car accident? Today, he may have contracted COVID-19 in the hospital, and his cause of death would have been listed as COVID-19. The complexity of determining cause of death percolates up in the system and makes it hard to know the effects of any given disease. COVID is actually a great example because many of the people we lost were over 80, and they would have died of something else had SARS-CoV-2 virus never existed, likely around the same time. To overcome these issues, when doctors want to know how many deaths were actually caused by something like a pandemic, directly and even indirectly, we look at excess death. Excess death is the number of deaths we would have expected during a period under normal circumstances above what was observed. You can use math to come at estimates in different ways. Our CDC very cleverly uses the Farrington method, which is supported by at least one published paper in the medical literature. Here are the CDC's calculations of excess death through the time period of the COVID-19 pandemic. The orange line is the average number of expected deaths, and the red line is the upper limit of the range of what was expected. The first thing I notice here is that people die more in the winter than in the summer. That makes sense to me because respiratory diseases are common in the winter, and historically respiratory diseases are the fourth most common cause of death. The other big three, heart disease, cancer, and accidents, are not as seasonal and stay more constant throughout the year. The COVID pandemic sticks out like a sore thumb. Remember, the first reports of the new virus in the US were in January of 2020. The first vaccine was approved in August of 2021, and Omicron came in November of 2021. You can see these peaks clearly on the graph. Well, what does this data tell us about when the pandemic will actually be over? Remember, we're mostly concerned with death, so science says that the pandemic is over when the excess death rate is 0.